I play a lot of music, and one of my hobbies is brass instrument repair. Pathologists tend to have very niche hobbies, and I thought that when I was around pathologists, it just felt like my own people. Pathologists might be a little more introverted, maybe they have musical, artsy hobbies, and I think that that's not always true, but it's largely true.
If you told Jeff Hayashi when he entered medical school that he'd be pursuing pathology when he left, he might not have believed you.
I wanted to be a trauma surgeon originally, so it was way different than pathology today.
Jeff's story began like many here at JABSOM. Born and raised in Hawaii, went to the mainland for college, but always had a desire to return home.
For some of us, we just love being in the islands, and that's where our family is, so it kind of drives us to stay, and that's certainly true of me. I couldn't imagine living anywhere else.
After graduating from the University of Portland with a biology degree, it was straight to JABSOM for Jeff.
Which I think was nice because it helped me save a little bit of time in my preparation for medical school, but in some ways it was a bit of a strategic disadvantage because I didn't have as much clinical exposure going in. I wasn't an EMS person, or I wasn't a medical assistant as many of my classmates are. So I came into medical school probably knowing about half of the specialties that were out there.
Like many students, Jeff knew what he liked.
I always liked histology. I always liked understanding things on a cellular basis, and when I talked to pathologists about that, it was almost second nature to them as well.
He found a certain level of comfort in pathology in his third year.
And I did some pathology rotations and really compare them side by side and just do pulse checks about, in what settings was I happiest? Did I feel most fulfilled? Did I feel like I was really contributing to the team in a meaningful way? And I thought that I could do that in pathology.
As Jeff progressed, it became clear his calling was pathology.
I like to think about medicine on the cellular level, which was a little bit of a glimmer towards pathology. And as I got more experiences in both fields, I gravitated more towards pathology as opposed to trauma surgery, just based on my personal interest and my personality.
He even found similarities with what he likes to do in his spare time.
On Reddit, they have Find the Sniper games. It's like when there's a picture of a field and there's a rabbit hidden. And I like to play those games to try to find hidden objects. And it really also kind of drives in this point that in pathology, you're not going to see things unless you know what you're looking for and you're actively looking for it.
Though JABSOM was always Jeff's plan, it truly was a perfect fit because there's no shortage of path mentors willing to guide students.
I think medical students here at JABSOM have a lot more exposure to pathology than medical students at other institutions, even larger institutions.
One of the topics that we talk about at the national level, but it's very relevant here too, is trying very hard to make pathology more visible during the medical school years, to try to encourage students to become interested in our very exciting and fascinating specialty.
This year, 2 JABSOM students, Jeff and Carly Kita, matched to the pathology residency program at Queens. And according to JABSOM's Area Health Education Center's latest workforce report, this couldn't have come at a better time, as Hawaii has a 43% shortage of pathologists.
We are thrilled that both Jeff and Carly are going to be with us. I've known them since they were first-year medical students. They've both shown very strong interest in pathology since that time, and they've done rotations with all of us, and we just are delighted they're going to be residents with us.
Many may think these two will be conducting autopsies, but there's a lot more to this specialty.
Pathology used to be an observational science where patients would die and we do autopsies and figure out why they died. That was probably true in the 1820s. Pathology has changed a lot since the 1820s, and we don't have an observational science anymore. It's really a field that is really broad, and it informs a lot of different specialties. One nice thing about pathology is it kind of leads specialties, because as medicine becomes more precise and more specific with molecular markers and sequencing, we end up having this field that is very, very scientific, and it's kind of driving these other specialties forward.
Jeff will be focused on surgical pathology. He'll be responsible for examining tissues and identifying cancers.
Does this cell look strange? Does the nuclei look odd? Are there too many nuclei, too few nuclei? Are they staining with this pattern or a different pattern? So it's a lot of pattern recognition, But when you're able to tell first the clinical team, like the surgeon, hey, I think this is cancer, you should be resecting a little bit more out of it, or maybe you're good, maybe your margins are clear, that's really valuable to the team. And it also makes you feel really special, because I think pathologists have some talents that are very rare among other doctors, and being able to see things that other people can't see, similar to what radiologists can do.
Jeff is also interested in transfusion.
If surgical pathology is the more well-known part of pathology, transfusion is one of the lesser known parts about pathology, managing blood transfusion reactions, making sure the blood bank is operating in ways that are conducive of like quality measures, and it's really just making sure that blood is available for when there are massive transfusion protocols that are being called.
In a true testament to their passion for pathology, and maybe a nod to their artistic sides, Jeff and Carly handmade this sign for Match Day, celebrating their commitment to meeting the needs of our state.
Well, we use gram stain, so the crystal violet and then the saffron, the reds. So that's what we use for the colors. And then the middle is just colored with crayons, because in pathology there's a lot of wax involved. So we wanted to make a sign that really was kind of like a slide.
We love visual aspects of our specialty, and I think maybe reading music or having dexterity for instruments is part of it.
For Jeff, two passions, professional and personal, intersecting for a perfect match.
I like to tell people, hey, if you do a pathology rotation, you'll probably like it. And you'll probably find that the preceptors are very nice. The atmosphere is reasonable, like in terms of hours, and the science and everything is really exciting. And a lot of the things that drive people to go into medicine, I think, can be applied to pathology.